So in this chapter, mainly we are going to discuss about diabetes and its guidelines. Now here, first thing is we need to understand clearly what is meant by diabetes. So generally, diabetes means, generally we'll explain it as increase in the glucose level, increase in the sugar level, like that. But here we need to understand clearly why that problem will come. Now actually this problem will start at the pancreas. So in the pancreas, we'll be having islets of Langerhans. And in the islets of Langerhans, we'll be having two different type of cells, that is alpha cells and beta cells. Now here alpha cells is responsible for production of glucagon and beta cells are responsible for production of insulin. Now here when there is a problem in the beta cells, which are located in the islets of Langerhans in the pancreas. Now when there is a problem in the beta cells, this will be impacting the production of insulin. So when there is a imbalance in the production of insulin, then the patient will be experiencing diabetes. So this is the main reason why the patient will be getting the diabetes. Now all these things will be coming under physiological changes. Physiological changes means the functions of the body parts will change. So for that reason, we'll call it as a physiological changes. Now in this diabetes, we'll be having different types. We have some classification for this, like two different classifications. The first classification is type 1 and type 2 diabetes. Now here type 1 diabetes, we'll call it as juvenile diabetes. Now juvenile diabetes means it is if the patient's age is below 12 years, then we'll call it as juvenile diabetes. Now this one we can also call it as non-insulin dependent diabetes mellitus, that is NIDDM, that is type 1 diabetes. And the type 2 diabetes is adult onset diabetes mellitus. That means if the affected person age is about 12 years of age, we'll be calling it as insulin dependent diabetes mellitus. So here overall two types, that is juvenile diabetes and adult onset diabetes mellitus. Now coming to the coding series, you'll be getting this juvenile diabetes in the series of E10. Now we'll see what is this E10. Now here you can see it here, E10 diabetes mellitus, type 1 diabetes mellitus. This also, these are all the synonyms for this, that is brittle diabetes and diabetes due to autoimmune process and diabetes due to immune mediated pancreatic islet beta cell destruction, idiopathic diabetes, juvenile onset diabetes and ketosis prone diabetes. Now these are all the synonyms. For example, in your documentation, if it is mentioned as diabetes mellitus due to autoimmune process, then you need to code for E10. So it will be directing automatically to E10 only. Okay. So not only here, whenever you are selecting any code, you need to check what all the things are included under that. So these are all the synonyms for this. For example, if you are searching for the code ketosis prone diabetes, still you will be getting the same code E10. Okay. Now this is for E10. And coming to the type 2, adult onset diabetes mellitus about 12 years of age. Now this will you will be getting in the E11 series. Now we'll check what is this E11. Now here E11 means it is a type 2 diabetes mellitus. Now you can see the includes notes here, diabetes mellitus due to insulin secretory defect, that is physiological changes. And even if it is not mentioned anything, that means only just in your documentation, if it is mentioned as only diabetes mellitus and nothing is mentioned whether it is type 1 or type 2, still you need to take the type 2. So type 2 diabetes mellitus or unspecified. So you can take E11 series. And insulin resistant diabetes mellitus, still you can code for E11 series. Now there is another classification here, that is primary diabetes mellitus and secondary diabetes mellitus. Now here primary diabetes mellitus means, as we have discussed this one, Now, all these things comes under physiological changes. His functions will be changing. So, if the functions are changing, then the patient will be getting the diabetes. So, that is primary diabetes. Now, coming to the secondary diabetes. Now, secondary diabetes means it will be caused because of the external factors. So, external factors in the sense like that may be because of stress, or that may be excessive ingestion of chemical agents, or excessive intake of steroids, or pancreatectomy procedure. Now, pancreatectomy procedure. Now, ectomy means it is surgical removal. So, pancreas, surgical removal of pancreas. Suppose if the patient has undergone the pancreatectomy, that is surgical removal of pancreas. So, when there is no pancreas, there is no question of production of insulin. So, in that case, we'll call it as secondary diabetes mellitus. Now, here there is a note we need to understand this one. If in the documentation, if diabetes type is not mentioned, but it is indicating the use of insulin, then code type 2. That means if it is nothing is mentioned in your documentation, you can code it as a E11 series. For example, if it is mentioned as just diabetes mellitus and it is not mentioned whether it is type 2 or type 1 or primary or secondary, nothing is mentioned. In that case, you need to take it in the E11 series. And also you can use additional code as Z79 series if the patient was using the insulin from longer durations. So from long time he is using the insulin, patient is on insulin and still he is going on insulin. So in that case only you need to code it as a Z79 series as an additional code. Now coming to this, now oral medications and insulin both are used for the patient's treatment, then code only for the long-term current use of insulin only. So here you need to understand clearly what is this long-term current use. Long-term current use, exact meaning of long-term current use means, let's say the patient is taking some medication from past 6 months or 1 year or 4 months. He is taking the medication and currently he is also on the same medication. In that case, you need to take it as a long-term current use. In that case, suppose if the patient is taking oral medications from the past 6 months and he is also taking the insulin from the past 6 months, in that case, you should not code for the oral medications long term current use. You can code only the insulin current use, long term current use of insulin. Now, this is a guideline here. Now, this is just for the diabetes. Now, the next one is complications due to insulin pump malfunction. So, what is meant by this insulin pump malfunction? So before that, you need to understand what is this insulin pump. So, generally, for the old age patients, they cannot take the medications properly in the regular dosages. So, in that case, what the physician will do is they'll be connecting the insulin pump to the patient. So, what this insulin pump will do is, so it will be pumping the regular dosages of insulin into the human body. So, that is a function of the insulin pump. So, when they're using this machinery or the pump, it will not be working properly all the time. So, sometimes it may pump excessive dose into the body and sometimes it may pump less dosages into the body because of the malfunction of the insulin pump. So what we need to do when we are coding for this underdose and overdose. Now here underdose you need to code for two codes here. That is first code will be T85.6X, that is mechanical complication of prosthetic devices. Now we'll see what is this T85.6. Now here if you see T85.6, it is mechanical complication of other specified internal and external prosthetic devices, implants and grafts.
Excuse me, I have a doubt.
Yes.
Generally, they give this T85.6X. Why the X is there? Is there any
No,
number we have to add or
no. X is a variable I've given here. That may be 2, that may be T85.62 or 6361. X is a variable here.
okay.
So
Thank you.
this one I've added as a variable here, but in terms
Mhm.
of coding, X we'll call it as a space holder.
Okay.
Okay. But here T85.66 I've given here because we have lot other options here. T85.61 you may get depending on the case, or else you can get T85.611, 611A, 612, 613, or 614 like this. Here
Mm.
you'll be getting it is if it is exactly insulin pump malfunction, then you will be getting T85.614A. Now you can
Okay.
see here
So the
mechanical.
X will be variable. It can be any
Yes,
code for that.
yeah.
Okay. Thank you.
Because for in the insulin pump, it is not only the insulin pump, it will be in the insulin pump again we have different parts which are associated with that. Sometimes for the insulin pump, the physician will be attaching the catheter, and the catheter will be in problem, and insulin pump will be normal, but the catheter will be in problem. So in that case, again your code series will change.
Okay.
Okay, so that
Okay.
depends on the scenario what where you are coding. For example, you're coding for epidural catheter. Okay,
Okay.
so now in that case, your X will change here. T85.620A you'll be getting here.
Okay.
Okay, so depends on the catheter. Like for example, this one was subdural infusion catheter, and now here if you are coding for the dialysis catheter, again your code series will change. T85.621A. Okay,
Okay.
so that X will be variable depending on your scenario.
Okay.
Now here this is also insulin pump only, but here it is not the breakdown, it is a displacement of catheter. Sorry, displacement of insulin pump. Now here you can see the code series has changed here. Just the word displacement has changed here of the insulin pump. Again your code series has changed here.
Okay. 24 years.
Yes.
Okay.
Okay. Now here intraperitoneal catheter. Earlier it was just a catheter. Now here insulin intraperitoneal dialysis catheter. Now again the code series has changed. Now the leakage of pump. Now the code series has changed. So it depends. That the code series will be depending on the breakdown, that is leakage or displacement. Okay.
Okay.
Now that's the first series you need to code, and here the second code will be T38.3X series. Now what is this T38.3X series? We'll see. T38.3. Now this is poisoning or adverse effect. Now we are considering here underdose of insulin. Now you can take any one code from this. Now here in this case, this X is a placeholder because this is not filled yet. So when I am saying it is not filled yet, that means there is no more specification added here. So still there is one more specification yet to come to fill this X. Okay, you clear? X is a placeholder here.
Okay.
So in future, this X is created for the future purpose. Suppose if there is one more specification added for this sentence here, poisoning by insulin and oral hypoglycemic drugs, intentional self-harm, initial encounter. Suppose for this, if they want to add one more specification in this sentence, they'll add this specification here and they'll add one number here. In place of X, they'll be filling with numbers. Okay. This will be the future purpose. That means no more specification still added to remove this X. Okay. So that is for underdosing of insulin and oral drugs, that is hypoglycemic drugs. This is for the underdose. So for the underdose, we'll be coding two codes, and the first code will be representing the mechanical complication of prosthetic devices, and the second code will be underdosing of insulin. Now coming to the overdose. Now here overdose is also considered as a mechanical complication here. Now here mechanical complications. Overdose caused because of insulin pump malfunction. So that comes under mechanical complication. Now here mechanical complication, you need to code it as a T85.6x, the same code, followed by T38.3x1. This is a overdosing. Okay. So two codes you need to code for these complications. The first code will be mechanical complication and the second code will be underdosing or overdosing depending on the case. Now here when I say these complications, now there is another specification here for the complications. Now what is meant by a complication? Complication means, for example, patient is placing some kind of device into the human body, and when he is placing the device, definitely there would be some problem because of the device. So there would be two different type of problems which will be arising with this device placement. The first one is either the device may be either the device itself may be in problem or the patient's body is facing some problem because of the device. So different things will be there. Suppose if the patient's body is in problem because of the device, that we'll call it as infection and inflammatory complications. So what type of things you can expect in this infection and inflammatory complications? Like swelling or pus formation or blood formation or some kind of cellulitis. So all these things will be coming under infection and inflammatory complications. Suppose the device itself is in problem. So what kind of problems the device may be facing here? Either the displacement may happen here, or there may be some breakage, or dislodgement will be there, or displacement will be there, leakage will be there. So all these things will be coming under mechanical complication. Okay. So two types of complications are there. So this is very important because wherever you go, like in whatever the chapter you go, if there is a surgery, the post complication of surgery, it may end up with a mechanical complication or infection and inflammatory complication. So there you will be deciding based on these two things, whether the device is in problem or body is in problem. Okay. Next. So how to sequence this diabetes course? Now suppose if the scenario is like this, secondary diabetes mellitus due to pancreatectomy. Now in this case, how to code it? Now here already we have discussed secondary diabetes due to pancreatectomy. That means this is a surgery. Pancreatectomy is a surgery, that is surgical removal of pancreas, and because of that the patient has got the diabetes. So that will automatically come under secondary diabetes. Now in this case you need to sequence the codes like this. The first code will be E89.1. Now we'll see what is this E89.1. Now you can see it here. Post-surgical hypoinsulinemia or post-procedural hypoinsulinemia and post-pancreatectomy hyperglycemia. So the first code will be E89.1. Now when you are selecting this code, you can see it here, use additional code. So what are the additional codes you need to add? That is E13 series you can add, and acquired absence of pancreas you can add, because pancreatectomy is done. So when the pancreatectomy is done, the pancreas will not be there. So for that you need to code it as acquired absence of pancreas, Z90.41. Now you can see the codes here. Now this is what you need to code for. E89.1, that is post-procedural hypoinsulinemia. With that you need to code for E13 series, that is secondary diabetes. And with that you need to code for Z90.41 because it is representing the acquired absence of pancreas, because here the pancreatectomy is done. Is you clear? Are you clear? Any questions in this? Okay.
So in the
Second,
questions, if they mention yeah, post procedural hypoinsulinemia, we have to code E89.1 like that, right?
See, you should never expect the same content will be given in your scenario, because
Okay.
when you're going live, they will not explain like this. Post-procedural hypoinsulinemia, they will not explain like this. So they'll be explaining like this. Patient has undergone the pancreatectomy. As a result, he has got he has got the diabetes because of the pancreatectomy. So like this, you'll be getting.
Okay.
So you need to understand that clearly, that when the patient has undergone the pancreatectomy, if he is getting the diabetes mellitus, that will be considered as a secondary diabetes mellitus, and that is
Okay.
also considered as a post-procedural hypoinsulinemia.
Hypoinsulinemia.
Yeah. So then you need to code for E89.1. So once when you get this code, it will be easy to code for rest of the two things, because you'll be following the guidelines here. When you are selecting this E89.1, when you are checking under that, it will be guiding you what additional code you need to add with this. Now here it's a clear instruction here, use additional code, that is acquired absence of pancreas. This one we have selected here because already the pancreatectomy is done in this case. And the second thing is, this is
Post
diabetes
pancreas.
yes, post pancreatectomy or post procedural. So you need to take the E13 series.
Okay.
Okay.
అండ్
That means
ఇన్సులిన్
after
యూజ్ కూడా ఉంది
removal of
కదండి.
Sorry.
కింద ఇన్సులిన్ యూజ్ కూడా ఉంది కదండి, యూజ్ అడిషనల్ కోడ్ దగ్గర.
But here there is it is not mentioned, right? Just now I told you, right? If it is mentioned clearly that the patient is on insulin, then
Okay.
only you need to code for long-term current use of insulin. But here insulin usage is not mentioned here. Suppose if I add something here, the patient is using diabetes, that is insulin for this diabetes for the longer durations, then you need to code it as a long-term current use of insulin. But here nothing is mentioned, so we are not picking up that code. Okay.
Okay.
Now the second one, secondary diabetes mellitus due to drugs. Now it will be same like this, due to pancreatectomy. Now here this is due to drugs. Now this secondary diabetes due to pancreatectomy and due to drugs, already we have seen this here. What is meant by secondary diabetes mellitus? It will be causing because of the external factors, that may be stress, chemical agents, steroids, or pancreatectomy. The same thing we are representing here. Secondary diabetes due to drugs and pancreatectomy. Now this case, if the secondary diabetes, if the patient is facing because of drugs, then you need to code the T36 to T50 series as a primary code. Now what is this T36 to T50 series? Now this is poisoning and adverse effect. So all this series you can code it depending on the scenario and the type of drug. Now here these are the different type of drugs: beta-lactam antibiotics and chloramphenicol. So these are all the drugs. So depending on the drug, your code series will be changing here. Macrolide group of antibiotics here, and tetracyclines. So these are all the different type of drugs you will be coming across here: aminoglycosides and rifampicins and antifungal antibiotics, systemic antibiotics. So like this, T36 to T50 series, you will be coming across different type of drugs. Like here you will be getting sulfonamides, that is in T37 series, and antibacterial drugs. And if you go for the rest, next one, here you are getting glucocorticoids in the T38 series, and thyroid hormones, antithyroid drugs. So like this. Now here it is aspirin drug. So these are classified under this non-opioid analgesics. And if you are going back, underdosing of hormones. Now these are all the different type of hormones. Now here narcotics and psychodysliptics. Like this, you will be having different classification of drugs. anesthetics and therapeutic gases, and anti-epileptic, sedative, and hypnotic, and psychotropic drugs. So like this, you'll be having different series. So in this series, you can code it any code depending on the drug. So here, what is the type of drug he's using? Based on that, your series will be changing, whether you need to code for T38 series or T40 series, T49 series, like that. And secondary code will be E09 series. So what is this E09? Now we'll see that E09. Now E09. Now here E09 is drug or chemical induced diabetes mellitus. Drug or chemical induced diabetes mellitus. Now here, what is the description? Here it is mentioned. This description is very, very important. Whenever you are selecting any code, you need to read what is that it is mentioned under that. Now here E09 is there, drug or chemical induced diabetes mellitus. Under that, immediately if you check, code first, poisoning due to drug or toxin, if applicable, T36 to T65 with fifth or sixth character 1 to 4 or 6. Now here we are selecting the code from T36 to T50 series. Now here this one. Use additional code for adverse effect if applicable to identify T36 to T50 series. And also you need to use the additional code to identify any insulin usage. So these are the two things you need to add it here if the documentation is there. Now anyways, you are coding T36 to T50 series first, then followed by E09 and long-term current use of insulin. If the patient is using the insulin for the longer durations, you need to add this code also. Okay. Are you clear?
యా అర్థమైనట్టే ఉందండి. బట్ వన్స్ వి ప్రాక్టీస్ మేబీ విల్ కరెక్ట్.
ఇంకోసారి రేపు రికార్డింగ్ చూసుకుని ఇంకొకసారి ఇంకా బాగా అర్థమవుతుందండి.
Yeah.
Yeah.
Also, I'm sending some supportive documentation to you now. You can just go through that. The same thing which I have told you now. Just check it. I have shared you in the group.
ఓకే.
This is the same thing, but it will be in a systematic way with an example.
ఓకే.
ఓకే.
Okay, you got that?
యా
ఇది రాలేదండి.
ఇదండి ఇది రాలేదండి సెప్సిస్ అను.
No, just now I've shared it now. Now only I've shared it
యా అండి.
on your WhatsApp.
యా అండి.
Okay. This is the simplest
Yeah.
documentation. It will be around 15 to 16 slides will be there. Just go ahead with that.
ఓకే.
Okay. So the same questions like this you will be getting in the CPC exam. So just if you open the document, for each topic there are some questions. At the last you can see example. Diabetes mellitus patient came for treatment of cataract. E11.36. Got it?
Yeah, I got the document, but there is
The
no
last slide.
question or anything.
There's a last
ఈ-
slide
ఇవి
stating examples.
No, I didn't get
స్లైడ్
anything.
లో ఏమీ లేదండి.
Blank
Plain
గా
ఉంది.
ఉంది బాగా.
బ్లాంక్ గా ఉన్నాయి పేపర్స్ మాకు.
Yeah.
No, you need to download the this one PPT presentation one. Just a moment.
ఓ.
Now just you can check it now.
Yeah, now it has come.
Now it's in the PDF format. Just open it and go for the last one, examples.
Yeah, diabetes mellitus patient came for treatment for cataract. That one.
Yeah, diabetes
Which one?
mellitus patient came for treatment of cataract.
Cataract. Yeah.
Yeah, you need to-
11.36 is also.
yes, 11.36. So here, so why we are taking this 11.36 here? It is type 2 diabetes mellitus with diabetic cataract. Now here in the guideline I've told you, if nothing is mentioned, you need to code for the type 2 diabetes mellitus. Okay. If nothing is mentioned, you need to take it as type 2 diabetes mellitus. So that's why we are taking E11.36 for this. Okay. And you can also check the next question. A patient with mild stage of chronic kidney disease admitted to the hospital for the treatment of retinopathy, and the patient is on insulin. So when it is mentioned as patient is on insulin, immediately what is the last code in that? We are given with some codes there. In that, what is the last code? Z79.4. Got it? The last code.
Yeah.
అవునండి.
The last code is Z79.4. You can add this insulin code. Just now you have asked, right? So why we are not adding this insulin. So here insulin code can be added if it is mentioned here clearly, like patient is on insulin. So that's why we had added Z79.4. That is the last code. And what is the first code? E11.319. Now, what is E11.319? That is type 2 diabetes mellitus with unspecified diabetic retinopathy without macular edema. So it's there on the screen. You can see it. E11.319, that is type 2 diabetes mellitus with unspecified retinopathy. So the first code. And E11.22. Just try to code this on your own. You'll understand it. If you're not getting it, just let me know. Okay. The same things here we have discussed complications due to insulin malfunction and type 2 diabetes mellitus, type 1 diabetes mellitus. Got it? Hello.
యా అండి చూస్తున్నాను.
Yeah, just try to go through that. And if you have any doubts, we can discuss in the next session. So daily we'll be discussing one topic. And I'll be sending you the notes like this.
ఓకే. అండ్ ఇది రికార్డింగ్ కూడా పంపించండి కొంచెం. సో మాకు కొంచెం క్లియర్‌గా అర్థమవుతుంది.
Yeah, I'll be sending it now only. Just hold on for a minute.
షూర్.